This video is about ordering CT scans. There are two different ways to do that. One way is individual ordering, orders by name. And if you start typing in CT, then it will weed out all the non-CT orders, and you could order them this way. However, in the emergency department, it's probably better to do it with the pre-built order sets. So if you go to order sets by category, if you type in ED-RAD, it will wean you down to these. So lower and upper extremities, neuroimaging will have head CTs as well as MRI. Spine will have spine CTs. Ultrasound is the different modality altogether. And this is what I wanted to focus on here today. This is basically a recreation of the paper CT protocols for chest, abdomen, and pelvis. So let's have a look at that. The yellow headers here have the different types of studies with notations about whether or not it has IV or oral contrast. And then just below that are the different clinical conditions that the study is intended to evaluate, occasionally with other little notes here about they're going to scan them at 2 hours no matter how much contrast they've gotten in. Here's the order itself. Again, you can see it's prefaced with a CT. And then you'll notice that the edit button is red here. So let's go into that and see what is required. There are two required fields here. Sometimes that's pre-filled depending on the nature of the study. This is saying, no, we're not looking for DVT or pulmonary embolus, but you still have to fill in the reason for the exam. This is something that the radiologists actually use, and putting clinical information in here, taking the time to do that, does pay off, because I think you get better reads from the radiologist that way. If you don't know the renal function, here's an opportunity to order the iStat to look at the creatinine, and the radiology department is asking that you order the oral contrast as well. So if we scroll down here, we can see the different types of studies. Here it is with no contrast. Here it is the chest with IV contrast but no oral. And then you can see the other different types of studies that are similar to the existing paper protocol set. I do want to point out one other thing here about the chest with IV contrast. Let's go in here and look at this a little more about is this being ordered to diagnose DVT or PE? If you're suspecting a pulmonary embolus at all, put in a yes, and the reason for exam would be chest pain. If it's somebody with known malignancy, for instance, and you're looking to see the extent of the spread, you could say eval mets. That information is actually useful. It is used downstream. Your time spent doing that does help the system along. So it's worth a little while looking through the contents of the radiology studies. I think it will streamline things for you in your ordering.